In our last video, we talked about the signs and symptoms of heart failure. Now let's talk about the available treatment options for this condition. Before we start, it's important to note that heart failure is a chronic disease needing lifelong management. However, with treatment, signs and symptoms of heart failure can improve, and the heart sometimes becomes stronger. Doctors sometimes can correct heart failure by treating the underlying cause. For example, repairing a heart valve or controlling a fast heart rhythm may reverse heart failure. But for most people, treatment of heart failure involves a balance of the right medications, and sometimes use of devices that help the heart beat and contract properly. Heart failure is managed either by medication or surgery. Doctors usually treat heart failure with a combination of medications. Depending on the symptoms, the patient might take one or more medications. Angiotensin-converting enzyme inhibitors, such as enalapril, decrease the strain on the heart by relaxing blood vessels to lower blood pressure, thus improving blood flow. However, for people who can't tolerate ACEI inhibitors, Angiotensin II receptor blockers are prescribed to manage heart failure. Examples include losartan, valsartan, and candesartan. Furthermore, beta blockers may reduce signs and symptoms of heart failure, improve heart function, and help patients live longer. Examples of these drugs include carvedilol, metoprolol, and bisoprolol. They work by lowering heart rate and reducing blood pressure. Patients with heart failure usually experience shortness of breath and leg swelling. This is due to the accumulation of fluids inside the body. In this case, doctors prescribe diuretics to make the patient urinate more frequently and keep fluid from collecting in the body. Because diuretics make the body lose potassium and magnesium, the doctor may also prescribe supplements of these minerals. It is important to monitor levels of potassium and magnesium in the blood while taking diuretics through regular blood tests. Also, potassium-sparing diuretics, such as spironolactone and eplerenone, have additional properties that may help people with severe systolic heart failure live longer. Unlike some other diuretics, spironolactone and eplerenone can raise the level of potassium in the blood to dangerous levels, so it is important to talk to your doctor if increased potassium is a concern and learn if you need to modify your intake of food that's high in potassium. In addition to diuretics, digoxin, also called digitalis, increases the strength of the heart muscle contractions. It also tends to slow the heartbeat. Digoxin reduces heart failure symptoms in systolic heart failure, so it may be more likely to be given to someone with a heart rhythm problem, such as atrial fibrillation. Lastly is a drug combination of hydralazine and isoservide dinitrate. This combination helps relax blood vessels. It may be added to the treatment plan if the patient has severe heart failure symptoms and ACEI inhibitors or beta blockers haven't helped. While most patients with heart failure take medications, some require surgery or other procedures to implant cardiac devices to treat the underlying problem that led to heart failure. If severely blocked arteries are causing the heart failure, coronary artery bypass surgery may be performed. The procedure involves taking a healthy blood vessel from the leg, arm, or chest and connecting it below and above the blocked arteries in the heart. The new pathway improves blood flow to the heart muscle. Implantable cardioverter defibrillators are used to prevent complications of heart failure. They aren't a treatment for heart failure itself. An ICD is a device similar to a pacemaker. It's implanted under the skin in your chest with wires leading through your veins and into your heart. The ICD monitors the heart rhythm. If the heart starts beating at a dangerous rhythm, or if your heart stops, the ICD tries to pace your heart or shock it back into normal rhythm. An ICD can also work as a pacemaker and speed your heart up if it is going too slow. Lastly is heart transplant. Some people have such severe heart failure that surgery or medications don't help. These people may need to have their hearts replaced with a healthy donor heart. A heart transplant isn't the right treatment for everyone. A team of doctors at a transplant center will evaluate the patient to determine whether the procedure may be safe and beneficial in each case. That's all we have for today. If you know someone with heart failure, send them this video to help them understand their condition more. Don't forget to like, share, and subscribe to support the channel. See you next time.